Hello everyone, my name is Kim Miller and I'm with Dr. Amy Doneen today. And we are going to talk about cardiovascular disease, heart attack, stroke, and the risk that bleeding gums present when you have both of those things going on. So Dr. Doneen, we've done an interview before. A couple of years ago we did one. And one of the things that we talked about was the relationship between bleeding gums and what's going on inflammatory-wise in the rest of our body. Now, I share that video with a lot of people, and I have a lot of naysayers who just simply don't believe that there is a direct relationship. And so my question to you today is, for those naysayers that are out there that are thinking, gosh, I think that we're overinflating the risk, and is it really true? Can you respond to that? I mean, is this really true that if your gums are bleeding, it puts you at risk for heart attack, stroke, diabetes, autoimmune disorders, erectile dysfunction, preterm low birth weight, stillbirth, cancers? I could keep going, right? Alzheimer's?
Well, really what you're describing is an inflammatory process.
Yes.
So it's not normal that our skin bleeds. So if I'm walking around and my back of my hand is constantly bleeding, I would be concerned about an unhealing lesion. I would be wondering about that. So just the pure inflammatory connection is one element. The second element that's far more objective is that you and other colleagues have helped us really understand the importance of the pathogens that you as a hygienist are so expert in identifying and treating. It's these pathogens, Kim, that really drive the vascular cascade of this. And the article that we published in Postgraduate Medicine looking at basically the 5 bad boys.
Yes.
I can't pronounce them all.
I call
AA, PG, TD, TF, FN, right? All these bad guys that actually we demonstrated by using a model called the atherogenic triad. And we were able to do a deep dive into the literature to really say how each of these pathogens affect the atherosclerotic disease process in an objective way, finally saying and proving causality, which means if we fix it, they're going to get better.
Yes.
So when you talked about the whole body from brain health to eye health to heart health to kidney health to peripheral vascular disease, what drives those diseases of aging is really atherosclerotic of the arteries. Some are as small as a human hair and some are large. And the reality is we need to look at everything.
Right.
That can mess that system up, right? One big cause of vascular inflammation is your world, which is oral health.
Absolutely. So arteriosclerotic vascular disease, simply put, is an inflammatory condition.
It's inflammation. And our job clinically is to find out all sources of inflammation within that patient.
Including the mouth.
Including the mouth. Because what we know is this is connected to the rest of the body.
That's right. And if your gums are bleeding, these 5 bad boys, well, and I've kind of fondly coined them the fierce 5.
Oh, cute.
When I talk about them
I like
in my
that.
programs. And so these bacteria, when they enter the bloodstream, indeed put our patients at risk.
Yes.
Okay, so we can lay this to rest.